All right. So today we are going to discuss Chapter 11, Principles of Pharmacology. This is a very important topic for EMTs to study because a part of our job is to administer certain medications. And it's best to understand how these medications work, when to give it, when not to give it, and what we hope will happen when we administer these medications. So it's important for us to discuss what medications are within the EMT's scope of practice, what are the indications and contraindications of these medications, and some of the dosages. This is an important intervention because a lot of medications that we utilize help protect a patient's airway. For example, we would utilize albuterol for someone who might be experiencing an asthma attack. There's also epinephrine that we utilize when patients are experiencing anaphylaxis. Failure to administer these medications can lead to some serious consequences. Again, we're going to be discussing some of the contraindications for some of these medications, which means these are periods of time when we do not administer the medication because the negative effects outweigh the possible benefits. And if we disregard some of these contraindications, that could result in legal action being taken against us. So, again, understanding when and when not to give certain medications is going to be very important for you to understand. As an EMT, you are allowed to administer certain medications. Also, you can help patients self-administer certain medications, and we'll go into that in some detail. First, let's discuss some vocabulary that is very common when we discuss pharmacology. For example, pharmacology is simply the science of drugs. Medication is defined as a substance used to either prevent or treat disease or relieve pain. Now, EMTs do not necessarily carry medications that relieve pain, or we have indications to relieve pain. A lot of medications that are centered around us are preventing and treating immediate life threats. Pharmacodynamics is the process by which the medication works on the body. So this is more the mechanism of action. So when we administer this medication, what is happening on the inside of the body? And again, that makes it better to understand how these work within our body rather than just saying, oh, you are exhibiting these signs and symptoms, I'm just going to give you this medication. Rather, you see these signs and symptoms and you know what is going to happen to the body or how the body is supposed to respond when you administer the medication. So it's a little bit more in-depth knowledge rather than you see something, you do something. Now, here's some more terminology. We have an agonist, which this refers to a medication that would activate a specific response within the body. For example, the illegal street drug methamphetamine would be a stimulant. So methamphetamine would bind to some of the receptors around our heart, which would stimulate the heart to beat faster, for example. And there's many, many, many other medications and illegal drugs that would be an agonist or cause a specific response. And antagonists, these are medications that block a specific response. For example, naloxone or Narcan, we use that as an opioid antagonist. When we take opioid medications, morphine, fentanyl, or illegal street drugs such as heroin, which could be laced with some fentanyl, we administer Narcan because it binds to the same exact receptor that the opioid drug would bind to as well. And rather than having decreased level of consciousness, decreased respiratory rate, the naloxone would antagonize this response. It would block the opioid from binding to the opioid receptor on cells, which would elicit these specific responses. The dose is how much we would be administering to the patient. So, for example, we'll stick with naloxone. The dose for naloxone is 4 milligrams. And we'll talk about how we administer naloxone as well. The action is, what do we anticipate the response to be? How is the medication acting on the body? Indications. These are the reasons why we would give the medication to a patient. Contraindications. These are the reasons why not to give specific medications to patients. Then we have the side effects. A good example is Benadryl. If anyone has taken Benadryl, they probably feel drowsy. And that's a very common side effect that would happen with diphenhydramine or Benadryl. These are undesired effects that don't necessarily cause harm. Some cases they can, but oftentimes these just make the patient feel funny in some way, shape, or form. Now, when you start learning medications, you're going to learn really quick that they might have multiple names. And we have two distinct classes of medication names that you should be familiar with. So, generics are the simple, clear, non-proprietary name. So, a name that isn't owned by a large pharmaceutical company. For example, ibuprofen. The trade name is the brand name. So this is owned by the pharmaceutical company, and this is how they market their medication. And it's possible, depending on the manufacturer, that a drug might have more than one trade name. For example, Tylenol. Tylenol, also known as acetaminophen. Then when we're talking about ibuprofen, we have Motrin, we have Advil as well. Those are trade names for generic medications. Now, along with the variety of different names, we have different divisions on how we would separate medications. Mind you, these are all very important to collect when we are assessing patients' medical list or medication list. So when you guys are going through your sample and OPQRST questions, we want to collect as much information as possible. What is this patient consuming on a daily basis? So we have prescription medications. These are only obtained through a pharmacy, and you have to be prescribed by your physician for these medications. So these can be various different psychiatric drugs, antidepressants, pain relieving medications, antibiotics, and the list can go on and on and on. Over the counter or OTC medications, these are ones that you can buy without a prescription. You do not have to go to a pharmacy to get them. You just walk up to the shelf and you can grab them off that shelf. For example, Tylenol, ibuprofen. Those come in over-the-counter dosages in which you can purchase without that prescription. We have recreational drugs. These include cocaine, ecstasy, marijuana, methamphetamine, heroin. And again, the list can go on and on and on. Herbal remedies. These are natural, these are plant-based medications derived from a wide variety of different herbs that are available on the market. We have enhancement drugs. These can be steroids, for example, or any other performance-enhancing drugs that you might have been familiar with. Then vitamin supplements. These like Centrum or One a Day, what have you. These supplement the wide variety of different vitamins and minerals that we should be consuming with a normal, healthy diet. Now, as I mentioned, it is important that we acquire a list that covers all of these bases, because even though we have herbal remedies, these are natural. We have enhancement drugs, which might mimic certain hormones in our body. Vitamin supplements, these are over the counter and all of this. There is still an opportunity for all of these to interact in some way, shape, or form. Anything we consume leads to the potential for some form of interaction, which might be the reason why you might be called there. For example, someone might have an altered level of consciousness, and then you find out from a doc that a combination of what they were taking was causing the altered level of consciousness. So don't just get tunnel vision on prescription medications. They are important, but our job is to paint the most complete picture that we can for our patient. Now, routes of administration. Depending on the medication that we are utilizing, there are various different ways that they can be given to a patient. And understanding the different routes will be important to understanding why we deliver certain medications in certain fashions. So absorption is the process by which medications travel through the body tissues to the bloodstream. So how are they absorbed? Kind of like a sponge. How does the body take them in and utilize them? Enteral medications enter the body through our digestive system. So pills, when we take Tylenol or ibuprofen, when you guys are having a headache while studying for this class, you swallow the pill, your stomach breaks it down, and as it passes through the small intestine, your body starts to absorb that medication into circulation, allowing your body to utilize it. The parenteral medications enter the body by some other means. This can be an injection, for example, when you go and get your flu shot or any other type of vaccine. You might get stuck in the arm with a needle, and it's intramuscular, so it's injected into the muscle. Your body absorbs the medication through the muscle into circulation. And we're going to discuss a wide variety of different ways medications can enter the body. So Table 11-1 discusses or outlines the different routes of administration and rates of absorption for this particular route. So our enteral routes include sublingual or SL. As you can see, some of these have abbreviations that you should be roughly familiar with. But sublingual is beneath the tongue. Underneath our tongue, we have a lot of capillaries. It's a very vascular region of our mouth. And Certain medications could be delivered underneath the tongue, for example, nitro tablets. They dissolve really quickly and they get picked up by the capillaries very easily. That's why it has a rapid absorption rate. Per rectum. This is something that is inserted into the rectum. These would be medications that are in the form of a suppository. And again, kind of like below your tongue, the rectum is also very vascular. And once the medication dissolves, it gets absorbed really, really fast and thrown into circulation. We have by mouth or PO. These are slow. These are the pills that you would swallow. It's slow because your body has to break the medication down prior to absorbing it, which can take some time. Then we have our parenteral routes. We have intravenous or IVs. This is inside of a vein. So when you start an IV on somebody, you are actually inserting a catheter into the venous system, typically in the arm, can be on the hand, in the forearm, or in a wide variety of other locations. When you deliver medication through this route, you are pushing the medication directly into circulation rather than waiting for it to be absorbed in some other part of the body. Intraosseous or IO. This is actually an IV-like catheter that is drilled into the bones. This can be bone in your tibia or in the humerus area or in your shoulder, or in some cases into your sternum. A lot of people forget that our bones are where our blood cells are made. And again, that makes them very, very vascular. So it's common to be used in cardiac arrest because when a patient's in cardiac arrest, their veins may not pop out, and it'll be very difficult to start an IV line on cardiac arrest patients. IO, very easy, very simple. You drill it into the leg and you have immediate access to the circulatory system through the bones. Inhalation, this, for example, is an inhaler. This is a medication that is aerosolized that you would likely breathe into your lungs. As we've discussed in our respiratory lectures, that our lungs are very vascular because they are reoxygenating blood. So what better way to deliver medication to deliver medication to blood that is being reoxygenated? It goes straight back to the heart and gets delivered to the rest of the body. We have intranasal. So this is medication that is delivered through the nose. A very good example that we're going to discuss is Narcan. Again, our nose is very vascular. If you guys are catching on, we put medication into places that are vascular, and that helps bring immediate effects. Intramuscular. So these are like your vaccines. There are other medications that can be delivered through this route. Not so much for BLS providers, though. Subcutaneous. Now this one's really interesting. So these are medications that are administered just beneath the surface of the skin. So this is below the subcutaneous layer. Not into muscle, it's in between the muscle and the subcutaneous layer. And these are designed to have slow absorption. So rather than having immediate effects, we might have long drawn out effects over a specific period of time with subcutaneous meds. Then transcutaneous, these are across the skin or through the skin. These are your patches. So pain patches are common. There are certain birth control patches that can be worn in chest pain patients. They might have nitro patches that provide a steady stream of nitro to relieve chronic chest pain. And again, the list can go on. And again, it's slow because we are anticipating long drawn out effects over a period of time rather than just hitting with medication all at once and then have it wear off. Now, the form of the medication typically dictates the route of administration. So we have tablets and capsules. We're probably going to swallow those. Solutions and suspensions. Depending on the medication, it could be administered IV or swallowed. For example, Pepto-Bismol is a suspension. That's why the instructions distinctly say, make sure you shake it up prior to using, because those tend to settle down, where solutions stay mixed up. We have metered dose inhalers. So if you ever had one of these as a child, or if you knew someone or know someone who has one of these, this, every time you press down on the inhaler, it releases a specific amount of medication, depending on what that medication is. And you can guarantee every time you press down on the canister, you are going to get the same dose every time. We have topical medications. A very common one is cortisone. When you're having an allergic reaction or you have some itchy spots on your skin, we have topical steroids that helps relieve the itch that might be on our skin. We discussed the transcutaneous medications, the patches, again, pain meds, nitro, and some birth control. We have gels, which would be something that is gel-like consistency. And we're going to talk about oral glucose here in a little bit. Then we have gases for inhalation. If you guys haven't realized, oxygen administration is technically a form of medication administration. All right. So we're going to briefly go through tablets and capsules. Capsules are gelatin shells filled with a powdered or liquid medication. Again, depends on what type of medication and what the manufacturer's preference is on how to deliver it. These tablets and capsules dissolve over time. And tablets are often containing other materials that are mixed with the medication and compressed. So there's filler that helps maintain the medication and also allows for a specific rate of absorption. Again, depending on which one we're talking about. But we rely on the digestive system to break these down and pass into our small intestine for absorption over a gradual process. So a solution is a liquid mixture of substances. We cannot separate what is dissolved in solution or by letting it stand. So once it's mixed up, it stays together. And many solutions are given IM, IV, or subcutaneously. So suspensions, these are substances that do not dissolve well in liquids. That's why we have to shake them up. And if we let them stand, if it's in a clear bottle, you can actually see where they separate, because the top layer or bottom layer, depends on the density of the substances, will be distinctly different. For example, Pepto-Bismol again. Top layer is going to probably be a lighter shade of pink, where the bottom is going to be a little bit more bold. That's because the medication is starting to settle towards the bottom. So our meter dose inhalers looks just like this. It can contain liquids or solids broken into small enough droplets or particles that we can inhale, and our respiratory system can help deliver it to the body. These meter dose inhalers, or MDIs, directs these substances through the mouth and into the lungs. And as I mentioned before, every time we push down on this canister and inhale, it is guaranteed to deliver the same amount each time. And often there will be a counter on the device to help you know how many doses of medication are left inside the little canister. So topicals, it can include lotions, creams, or ointments, and these are applied to the surface of the skin. Lotions, if you've ever used calamine lotion, this is like a pink, kind of looks like Pepto-Bismol, but when you have like poison ivy or something really itchy, you kind of just rub this on the affected area and kind of gives a little pink tinge to your skin, but it really relieves the itch. We have creams, so hydrocortisone. Again, it helps with itchiness. Then we have an ointment, which a good example is Neosporin. So when you get paper cuts or scrapes, you put Neosporin, which is bacitracin, which serves as an antibiotic and helps prevent infections of these minor wounds. If you feel an ointment, it kind of has an oily texture to it compared to creams and lotions. Transcutaneous medications, these are designed to be absorbed through the skin. So again, various different patches. Also referred to as transdermal medications. And here are a couple of examples that we've already mentioned. These are very important because we talk about it in BLS care and when we utilize an AED. We want to remove patches that might be on the chest and wipe off the substance that might be left behind, because we don't want that AED to inadvertently ignite that substance on the skin, and then we're going to be dealing with a traumatic injury. Also, again, if you are removing one of these patches, make sure you are wearing gloves and your appropriate PPE when you are wiping the surface of the skin, because you are vulnerable to absorbing that medication. So especially when we're dealing with pain patches and nitro patches, because we can suffer very significant negative effects that we do not want to deal with. Gels are semi-liquids, and they can be administered through capsules or through plastic tubes like this. And the most common gel that we work with on a regular basis is oral glucose. And they come in these tubes right here. There's 15 grams. That's why it's glucose 15. We know that if a patient consumes this entire tube, which they should, that will be approximately 15 grams of glucose administered. And we utilize this for patients with diabetes who might be suffering from low blood sugar. Then gases for inhalation. As I mentioned, oxygen is the most commonly used gas. And you guys should be familiar with the different modes of how we deliver oxygen to our patients. And again, go back, review the different devices and the different flow rates in which we would utilize these devices. Now, when we are administering medications, there are specific criteria that we have to meet and that we have to document, especially when we're assisting medications with, when we're assisting patients with their own medications. So we have to ensure that it's the right patient. So if, for example, we're helping with administering nitro to a patient, we have to make sure it is prescribed to that patient. If it's the patient's significant other or other family member, that does not allow us to give the medication to the patient. It doesn't even matter if the patient consents to using someone else's medication. It is out of bounds for EMTs to do perform those types of interventions. It has to be the right medication. Patients who are experiencing chest pain, yes, they are indicated to use nitro. But if someone stubbed their toe, that's not an indication to utilize nitro. The right dose. Again, we are going to discuss some dosages. We have to make sure we are familiar with the dosages of certain medications and how much we have available to give. For example, nitro tablets, I'm sticking with the nitro example as you can tell, is 0.4 milligrams of that medication. And we have to make sure it is up to par with that dosage. The right route. So make sure you know nitro tablets are probably going to be sublingual. They're not going to be swallowed or chewed up. They're just going to be placed under the tongue to be dissolved. So if the patient's saying, oh, put the nitro tablet rectally, we're going to sit there and scratch our head a little bit. We're not going to do that. The right time. So the expiration date. If the medication is expired, we cannot give it to that patient. And right documentation. So no matter what we do, we have to document when we gave the medication, how much, all of everything on this list, and what happened. Did the patient's condition improve or get worse? And that's very important as far as documentation goes. All right. So there are circumstances to when we administer medications. So we have peer-assisted medications. So this is when you are helping a fellow individual with medication. We're going to talk about how we assist in certain scenarios. We have patient-assisted medications, which is when the EMT is assisting the patient. Then EMT administered medication. So this is what we directly give the patient. We do not help facilitate instruction or any other means to the patient doing it themselves. And how we administer medications are determined by our state and local protocols and medical control. So we are talking in very simplistic terms, but when you get hired on at an agency, you will learn how to deliver certain medications properly and what you will be allowed to do. Now, some common oral medications that we utilize. First one is activated charcoal. This reduces the amount of medication absorbed by the stomach. And this is a finely ground powder oftentimes is suspended in the medication sorbitol, or it's a sugar-based medication, sorbitol. This helps facilitate the passing of the medication. It's essentially a fecal matter inducing medication. So once you absorb what you're trying to absorb, you want to exit out of the body. The contraindication is that we do not give this to patients with an altered level of consciousness, because this poses a potential airway issue. Because if they're not going to follow instructions and swallow the medication appropriately, it might go down the wrong pipe and into their lungs. That is not what we want to have happen. Now, it is important to know that this medication is used on suspected overdoses, but it ultimately depends on what the patient has overdosed on. So some contraindications for activated charcoal. If the patient has consumed a caustic substance, so for example, drain cleaner, this cannot be given to that patient, because one thing that this might induce is vomiting. And when we suspect that something like drain cleaner or bleach was consumed, we do not want that to come back up, because that can cause further damage to the esophagus. So if it is unknown, it's likely that we are going to withhold this for that reason, because we don't want to induce vomiting. So medication overdoses is likely to be used on those patients. Oral glucose. Your cells need sugar in order to produce energy. Without sugar, they don't function properly. So oral glucose is to treat hypoglycemia, or low blood sugar. Commonly diabetics, they might have accidentally taken an extra dose of insulin, or they took a dose of insulin without eating a proper meal, so their blood sugar goes down. Someone who isn't eating properly can experience low blood sugar. If you guys go long periods of time without eating, you might start to experience a headache that subsides after we consume some sugar or a normal meal. This here is kind of replacing that sugar directly. It's essentially gel candy that we're going to give to that patient. And the overall goal is to bring the blood sugar back up. Ideal range is 80 to 120. So we want to bring the sugar back up to where it is. And this is we have to make sure that we assess the patient's blood sugar to ensure that it's low. And again, depending on certain state and local protocols, that low range may not necessarily be 80. Some cases it can be 60, maybe 70. So make sure you are aware of what criteria you have to work with. We do not give this to unconscious patients or ones that cannot protect their airway, so they can't follow instruction properly. Again, same reason as for the activated charcoal. We cannot risk compromising that patient's airway if they are altered or unconscious. Then aspirin. This reduces fever, pain, and inflammation. But for EMTs, we do not utilize this for these reasons. We actually use it when we are experiencing chest pain, and it prevents platelets from aggregating together or sticking together. So you're responding to a chest pain patient and they meet the criteria. So you're suspecting that they might have a heart attack. We're going to administer 4 81 milligram tablets of baby aspirin for a total of 324 milligrams. The normal adult tablet of aspirin is 325 milligrams. But what is carried out in the field are 81 milligram chewable baby tablets because it's easier for the patient to consume. And also when they're chewing it up, the vasculature in the mouth, especially under the tongue, can start absorbing some of the medication prior to them swallowing it. So you get some absorption prior to the digestive process. So we can start reducing platelet aggregation and hopefully preventing a clot from building up in the coronary arteries. Now, contraindications include hypersensitivity or allergies to aspirin. Some patients do have these sensitivities. Do not give it to them if they tell you, I cannot take aspirin because I have bad reactions to it. Again, sensitivities all vary from patient to patient, but typically they might break out in hives or have anaphylactic reactions. So we don't want to cause more problems. If they tell you they have liver damage, bleeding disorder, or asthma, patients with asthma tend to have these sensitivities as well. So we don't want to compromise the airway. Bleeding disorders. We do not want to cause inadvertent bleeding from reducing the platelets sticking to each other. Then liver damage. Aspirin is processed at the liver. And when it's damaged, we actually leave a lot of toxic metabolites from the aspirin floating around in our bloodstream. And we don't want to cause more harm than good. And should not be given to children because it's likely that we are not dealing with a cardiac issue with children. Now, sublingual medications. The most common one that we utilize is nitroglycerin. It comes in 2 forms. The most common is the tablet, and sometimes it comes in a spray form. Depends on the pharmacy that you go to. But at the end of the day, this delivers 0.4 milligrams of nitro. The goal of this medication is to relieve chest pain in cardiac patients or angina pain. Patients with known cardiac histories might be prescribed by their doctor, and also depending on local protocols, you might be allowed to carry this medication. The spray, again, kind of like the metered dose inhaler, each spray is 1 dose or 0.4 milligrams. And what nitro does is that it dilates the blood vessels in the body. So again, when we're dealing with a potential heart attack, we are looking to maximize the amount of blood flow being delivered to our cardiac muscle. And nitro helps facilitate that process. Now, some contraindications include patients who are on ED medications or erectile dysfunction. So Viagra, Cialis, I believe Levitra used to be an old one. The reason for this is because patients on these specific medications have redirected blood flow to a specific region of their body. And one side effect that nitro can have is drastic drops in blood pressure. So it's important to monitor blood pressure when using this medication. And when they're on these medications, it can make these blood pressure drops worse. So again, we don't want to accidentally induce shock on the patient. Other contraindications, patients who have a blood pressure of 100 systolic or lower for the same reason. We don't want to drop that blood pressure any more than we need to. And make sure you check before and after administration. Because with nitro, you can administer up to 3 doses every 5 minutes if the patient is not experiencing relief. And again, monitoring blood pressure, because you will have some droppage of blood pressure after that first dose. So again, just to reiterate, 1 tablet you apply sublingually. Just tell the patient to stick a tablet underneath their tongue. Unless you're allowed to administer it, have the patient open their mouth, lift their tongue, and drop the tablet in their mouth. Same goes with the metered dose spray, but you're just using the spray bottle. Lift tongue, spray underneath the tongue. Now, epinephrine, also known as adrenaline, is released by our body under stress. So when we have our sympathetic response, it's because of epinephrine. It's known as a sympathomimetic, meaning it mimics the sympathetic nervous system. This increases our heart rate by causing the heart to beat harder, and it also causes vasoconstriction. Another effect that this has on the body is that it's also a bronchodilator, not vasodilator. So this is typically delivered with an auto-injector to patients with life-threatening anaphylaxis. Patients who are experiencing anaphylaxis are experiencing body-wide vasodilation. So we're dealing with shock issues now. So the container has gotten so big that our body cannot maintain its cardiac output. And it's also, they're experiencing bronchospasm. So their airway has essentially closed up. So this can be from a hypersensitivity to food, which is the most common, or to certain animal stings, for example, bees. Then for food, we have peanuts and a wide variety of others. And this is just an extreme immune system response to these sensitivities. When we administer epinephrine, we are going to help stabilize the blood pressure by causing those dilated vessels to close back up. And we are going to cause the airway that is closed up to open back up to allow oxygen to flow back through. Patients, when they are prescribed epinephrine, they are typically prescribed 2 auto-injectors because your body actually consumes epinephrine very fast. So depending on how sensitive they are, after a period of time, their body might go back into anaphylaxis. So they're going to possibly need that second dose. Adult dosage is 0.3 milligrams of epinephrine. Child dose is 0.15 milligrams of epinephrine. So easy way to remember, just remember the adult dose, then cut the dose in half to get your child one. Again, the patient should ideally be carrying their prescribed EpiPens with them at all times. Before we jump to naloxone, I do also want to mention when we administer the auto-injector, we are going for very muscular areas of their body. So the easiest, most convenient place to give EpiPens is on the lateral aspect of their thigh muscles, because you have a lot of muscle to work with there. And the needle that comes out of the EpiPen is fairly long and fairly thick, because we want to deliver the medication very quickly. So when you administer, lateral aspect to either thigh, doesn't matter which side, and make sure you hold it there for 10 seconds or so prior to removing it, because we want to ensure that that medication gets into the body. Because if you stabbed it and just pulled right back real quick, it's likely that they didn't get any medication. Naloxone, or Narcan, is used to reverse the effects of opioids during an overdose. And the most common and easiest administration route is intranasally, as pictured here. Naloxone has proven to be so safe and effective that law enforcement agencies even carry this. You can even buy it over the counter from a pharmacy if you know someone who is prone to overdosing, or if someone is on a specific medication like morphine or fentanyl and you're concerned about potential overdoses. The dose comes in a pre-loaded syringe, which makes her life so much easier. Then we have this cone-shaped device that goes into the nasal cavity, or the nostril. The dosage is 4 milligrams. So the proper way of administering this is applying 2 milligrams in one nostril and the other 2 milligrams into the other nostril. On the syringe here, you can measure it out so you know where to stop when you are giving this medication. As I mentioned earlier in this lecture, the overall goal is to prevent the opioid medication or drug from binding to opioid receptors. So when someone overdoses on these types of drugs, you will experience central nervous system depression. So respiratory drive can be shut off, which if we're not breathing, we're not getting oxygen, which could lead into cardiac arrest. And administering naloxone will help reverse these detrimental effects. Depending on the severity of the overdose, it might take multiple doses before you actually have an effect. But the majority of the time, once you get naloxone to therapeutic levels in the body, it works really fast and very well. Not many contraindications for this medication. So if you suspect someone who's overdosed on an opioid, they're going to probably have pinpoint pupils. So when you assess their pupils, they're going to be very, very tiny. They're going to have slow or stopped breathing completely as well. So oxygen, I think we've hit this plenty in respiratory. So just know and remember, your cells need this to survive. And know your routes of administration for this particular gas and the appropriate flow rates. So metered dose inhalers. These can be liquids that are turned into a mist or spray. This device is called a small volume nebulizer. So certain asthma medications like albuterol comes in a liquid form. It comes in a little bullet looking capsule that is dosed out entirely. We don't have to measure anything. And what we do is we put the medication in this little reservoir, hook the reservoir up to oxygen, set the flow rate, probably 10 liters per minute, depends on the device. But the oxygen flows into the reservoir and starts to bubble up, kind of boils it in a weird way, and creates a gas that the patient will breathe in and out. So we have the mouthpiece here. Then it's an open tube. So the patient can keep their mouth on it and inhale in and breathe out. So they don't have to keep moving it back and forth. Now, albuterol is an important medication for our airway. When patients experience asthma attacks, they are going to experience bronchospasm. So that airway is closing up and we have mucus secretions that start to build up as well because of the asthma. And again, we're going to have an airway issue. Albuterol, when we inhale it, stimulates the airway to open back up. So it's going to bind to certain receptors on our bronchioles that say, hey, we're going to open up, and they open up. It's a very fast absorption, so you should see effects fairly quickly after starting therapy with albuterol, and very portable, and yeah, it's very easy to use. Other side effects, you're going to have increased heart rate when someone is using albuterol because it is a stimulant. But again, with proper monitoring, the increased heart rate should not be of too much concern. So, aside from the medications that we can typically assist or administer, we need to get to know certain common medications. They are typically prescribed, and they actually give us a lot of insight into patients' medical history and can also help us guide our treatment. And it's useful for the hospital when evaluating patients for certain conditions. So getting to know patient medications is vital. There's a lot. You will slowly get to know these over time. There are applications that you can download onto your phone that are catalogs for medications. So if you come across one that is new to you, you can look it up and you can find out what it's for or what it's typically prescribed for. Because one thing that you might run into is patients who may not be familiar with their medical history, especially the older population. Because one common misconception is that when you're on a certain medication, you are essentially cured of certain diseases. But if you were to stop the medication, you'll start to exhibit signs and symptoms of whatever disease they might have been treated for. So you'll come across patients who don't know their history, but they're going to have a laundry list of medications. And getting to know them will help you gain insight to medical history. Now, medication errors, they happen. The important part is owning up to the mistake, because it's easier to help someone who admits an error than someone who tries to hide it. So inappropriate use of medication could potentially lead to harm. So we might have overlooked a sign or a symptom and given the wrong medication. It happens. But if we suspect any type of error that occurs, provide the appropriate patient care. All right. Treat the symptoms. Let medical control know so they're prepared. Document thoroughly, accurately, and honestly. All right. And also let your supervisor know and your medical director. Again, when you own up to a mistake, it is easier to simply sit you down and retrain you, go through a little bit of remedial training, and kind of look back and reflect on how this error occurred. If you try to cover it up, it means you probably knew what you did wrong and you don't want to be in trouble for it. That tends to lead people into termination and even getting your license revoked. Okay, so moral of the story, you make mistakes, just own your mistakes. All right. Now we're going to go through a quick review of pharmacology. So I'm going to give you guys a moment to read the question, and then we will go and show you the answer. So pharmacology is defined as the what? B. So pharmacology is a field of science that deals with the study of drugs and medications. So A, this is physiology, which is a branch of biology. We know B is the correct answer. For C, the effects of medications in the lungs, this is actually considered pharmacodynamics, which is the process of the body's response to that medication. Distribution of drugs to the body's tissues, this is referred to as pharmacokinetics, which is how the medication is distributed within the body. Which of the following statements regarding medications is false? All right, C. Over-the-counter or OTC drugs do not require a physician prescription. So as I mentioned earlier, you should be able to walk up to the shelf and grab one of these medications off of the shelf and check out. Don't need a note from your doctor or anything like that. Everything else, as far as our choices go, we are familiar that they have multiple names. And we also want to get a complete picture of the different types of medications and understand how they can affect the body in different ways. Which of the following routes of administration has the fastest effect? B. Okay. So when we're looking at the other choices, it comes down to table, I think it was 11-1. Just pay attention. We're not going to give you ones that are very close to each other. They're going to be very obvious with different routes. So know the differences between speeds on all of your routes. When applied to a patient, a metered dose inhaler will A. All right, metered dose, MDI. every time you deliver or press down on it, it's going to be the same amount each and every time. So ineffectiveness with patients with asthma, that's not correct. Patients with asthma are typically prescribed MDIs. Deliver a different dose each time. That kind of defeats the purpose of the meter dose. And deliver the drug to the lungs over a period of 6 to 8 hours. No, those are typically like your transdermal patches. MDIs are more immediate effects. All right. You're managing a 62-year-old woman who complains of crushing chest pain. Her blood pressure is 84/64. Her heart rate is 110 beats per minute. Medical control advises you to assist her in taking her prescribed nitro. After receiving this order, you should be. All right. So don't forget, contraindication for nitro is a blood pressure below 100 millimeters of mercury. As you recall, the blood pressure is 84/64. So it's possible that the physician may not have heard the blood pressure correctly. So just reiterate it prior to following their instruction. Activated charcoal is indicated for a patient who have ingested certain drugs and toxins because it D. Okay. The point of this is to absorb whatever the potential overdose is on in the stomach and allows it to pass without your body absorbing it. With regard to pharmacology, the term action refers to what? D. All right. What do we expect to happen? What mechanisms are put into motion or put to action inside of the body when we administer certain medications? So, which patient is the best candidate for oral glucose? Remember, the big thing with this one is the conscious patient showing signs of hypoglycemia. So if you assess blood sugar, it's low. They might experience a headache, dizziness, and some level of lethargy. Unconscious patients, we do not give it because we're concerned about airway issues. Hyperglycemics do not need any more sugar The sugar is already high as it is. Then semi-conscious, again, you're concerned with their ability to follow instruction. Epinephrine is given to patients with anaphylactic shock because of its effects of all right, remember, bronchodilation. We want to open the airway. We want to vasoconstrict, which will bring up the blood pressure. It's very this is a very common question that you are going to come across. So make sure you read your answer choices very carefully. A common thing that I see a lot of students do, they just mix up which one is constricted and which one is dilated because they read the last half of the word and they just jump to that last final conclusion. So take your time when reading this question and the answer choices. Then the process by which medications travel through the body tissues until they reach the bloodstream is called what? C. Absorption. Now, if you guys go and look back at the choices, we had adsorption. All right, just a difference of a letter with A and C. So again, this comes down to reading your answer choices very carefully. And that concludes pharmacology, or chapter 11. So make sure, big thing is to review the medications, what EMTs are allowed to give, and how they act on the body. Very important topics. So when we are testing you on these things, we want you to understand what these medications do to our body.